Okay. Hey, it's Dr. Kilbane, and I'm here with Lacey, who did our constipation course for kids with her son, and she's going to share with us some of her experience. So, Lacey, thank you so much for carving time out of your day and to talk to us. And I'd love for you to share what was happening when when you joined the course, the constipation course.
Yes. I have a little boy. He is 3.5 years old. His name is Hayes. And man, it's almost been, I guess, a year ago, m- maybe about a year ago, that all of our issues started. So Hayes was going to the bathroom. It was actually last February. He was going to the bathroom, and it was after a long trip of our diet being off, not regular, that he was on the toilet and he had a prolapsed rectum. So thank God I am in the medical field, so I recognized it, knew exactly what to do, had to manually push my little boy's rectum back in, and went to my pediatrician the next day, just completely distraught and kind of a mess.
Yeah.
um, my pediatrician, who is great, reassured me that it would not happen again, and it was kind of just a weird one-time occurrence, and to start him on Miralax and to go on with our lives. So we had already started on Miralax. I started him on that the night before, just from my knowledge and what I had read. So we were already on board with the Miralax. We left the doctor's office, and that afternoon at about 5 o'clock, when everything always happens, his rectum prolapsed again. And I had to reduce it again. Called the doctor the next day and basically got the same thing, keep him on the Miralax. It will get better. We just started this. So this went on for about 3 weeks. It didn't fully prolapse again, but it was not perfect and things were coming out where they shouldn't. So I pushed and I demanded for a referral to a pediatric surgeon in town, um, who basically echoed my pediatrician, saying, well, let's keep him on Miralax. This is what we do. He'll be on chronic Miralax for 3 to 6 months, and this problem should resolve. Um, which I did not like that answer. So I started going deep down the rabbit hole, researching and learning and reading about Miralax and its terrible side effects. So immediately did drastic diet changes on our own, where we started to, which probably weren't the correct things to do, but we increased our fiber to probably way too much, bulking his stool, um, cut out a lot of processed foods, and increased our water intake pretty much, and kept on the Miralax off and on. We weaned off the Miralax and started on just an over the counter probiotic, and things got a little better, but they still weren't perfect. He was still having irregular bowel movements. He was still sitting on the toilet for prolonged periods of time. He was still up complaining on a daily basis, waking up throughout the night that his belly hurt and something wasn't right. So then I kind of took matters into my own hands, demanded a KUB, which came back to show moderate constipation.
And a KUV is an X-ray of the belly, just for people
Yeah,
who don't know that term.
yes, sorry. An x-ray of his cute little belly, and it
Yes.
showed that he had poop all in his belly. So I flushed him out with over the counter, what did I use?
Milk of
It,
magnesia or
uh I
laxatives.
I used some sort of laxative. Maybe it was milk of mag. I don't know. All of that has gone through my medicine cabinet. I threw it all away. So I don't even remember what we used, but he basically had a huge blowout and was okay and kept pooping, but still was not right. Still had belly pain, still was having these occasional partial prolapse of his rectum, still was having, waking up in the night. We went to New York City and we were at my aunt's house and his rectum prolapsed. So it was just a complete mess. So you, Dr. Kilbane, posted this constipation seminar, which actually my son's teacher is a retired nurse practitioner who told me about.
Oh,
So
wow.
yes, she's great. So she told me about it. I signed up through my account, through my husband's account, through my sister-in-law's account. I was desperate to get in. I think I emailed you maybe 3 or 4 times, and finally I got the response saying that I got in, and was just thrilled, over the moon. So I got into this course and haven't looked back. Our whole lives have been changed. We have occasional belly pain, but nothing like it was. And he has regular bowel movements. We have not had any prolapse of his rectum. I don't worry about going to bathroom situations. I don't worry about traveling. I don't pack extra things, or, I'm not prepared for it to happen because it's not constantly on my mind.
Yes.
So,
And the beauty, because you were so ready to make these changes, is it happened pretty quickly, right? Our course, we did it over 6 weeks, and you started to see the improvements within 2 weeks, would you say?
yeah, I mean, it took us a little while because the first week we did like the elimination diet, and he was already off all of his over the counter laxatives and stool softeners at that time. So by the time we did the first week of your constipation course, you do like the mini cleanse.
Mhm.
So we kind of already doing that portion of it. But then the second week we cut out dairy and started the probiotic, the digestive enzyme, and the magnesium. And by the time those 3 things were on board with us for 2 weeks, he has been great. We and I will tell you, I was never a firm believer in, dairy, give up dairy. Oh, it will change your life. I was a firm believer of, oh, my kids need 8 glasses of milk to strengthen their bones. I'm in orthopedics. That's what I've been trained. Kids need milk. So I wasn't a firm believer in giving up the dairy, but we cut it out cold turkey. And about probably, I think it was on like our 4th week, I broke because he begged for it, a glass of chocolate milk. And he didn't even have a full glass. He had half a glass and was up that whole entire night, rolling, crying, complaining of how bad his belly hurt. And he required Motrin because his belly hurt so bad. And
Mhm.
I was in tears. I felt like I failed the whole thing and was just so saddened that I gave in. But at the same time, the next morning I woke up and my eyes were open. I was like, you know what? We know the cause. We are so good. This little setback has brought so much insight to us that we know that dairy was a factor for Hayes, and he can't have it. And none of our family has dairy anymore. And none of us are constipated.
Right. Because we did a call, because we did, right, weekly, we did an open office hours call during the course, and we were able to talk through that, right? Because sometimes those little slip ups are a blessing in disguise, because we get to see how their bodies react quickly, and right, and not all kids react that way, but he did. And so it was a little bit of a blessing in disguise, because then you really know, okay, no, we've got to stay on this, we've got to keep doing this, for a while. And that's where this concept of cumulative inflammation is, he may be able to do it again at some point, but in much smaller quantities, and not get thrown off, and not have belly pain, and have all of that happen, right?
Yes, for sure, for sure. I mean, your course ended in August, and it's now almost November, and we have been off dairy, on his medication, and he is just, I I cannot say enough at how much of a believer I am in all of this, and how much it has taught me, opened my eyes to something so so forgotten, like in our traditional medicine world. And it's so sad. It's such an easy concept once you grasp it, like, oh, give up dairy. Okay, I know what dairy is, I can do this. But it's so hard. It was such a hard lifestyle change to give up milk, butter, cheese, everything that we love. But when you see that, the setback occurs, and you see that, it's not worth it. I don't ever want to cause my child pain, and now I know what I did.
Yeah. And it is, because the way I always talk about it is it's like healing a sprained ankle, right? So now we're back into your world of orthopedics. And if you have a sprained ankle and you keep playing basketball on it, you keep tweaking it, you're going to keep having these flare-ups. But if you say, I'm going to take 3 to 6 months, I'm going to get really serious and I'm not going to play basketball. It's the same thing with the gut. We've got to get really, tighten things up for that 3 to 6 months. And then usually after that, we can veer off a bit. So it's really, I loved the way that you embraced it, because it is, especially for somebody who's trained in the conventional medical world, it's different, and it's all about using nutrition and understanding cellular health and good gut health and the things that we need, right? Magnesium is just a mineral that we need. And we're trained to reach, when kids have constipation, to reach for Miralax, which is a laxative, right? And if you open up the packing slip for Miralax, it will say on there, don't use in kids under 17 and only use for a week. And we use, and it's under the guidance of your pediatrician and your doctor. Absolutely, you can use it in a different way. We use medications off label all the time in the pediatric world. And if we can shift things, right, and shift the nutrition and get his gut healthy, it's just his system is going to function so much better.
Yes.
So any advice that you could give any other parents thinking about this, whose kids struggle with constipation?
Yes. Well, one thing that I've definitely learned and that makes me very disappointed in like the traditional medicine world is everyone's just, or I shouldn't say everyone, a lot of people are looking for the easy fix and they don't want to try what's harder. So, you know, I see patients every day too who come in with knee pain and this and that, and they just want an easy answer. And if it's surgery, even if the risks don't outweigh the benefits and their outcome might be a 70% success rate, they want that surgery rather than trying something so simple. So I would say, do not give up, do not take the easy way out, dedicate your life to just making it really is simple once you grasp it, a simple recipe change, and you'll see just miracles happen where your kid is not on medicine and you don't have to worry and you can live a normal life without carrying extra pants everywhere.
Yes. And Lacey, has this changed your practice at all?
Oh, for sure, for sure. We joke a lot in my practice. I have told patients, about the hand in hand with arthritis, with knee pain, about how the inflammation component has so much to do with it. And do you really want me to inject something into your body that can give you a temporary fix when I don't see a lot of kids in my office, but those rare few and far in between, and and I'm not in your field, so I have to be more careful. Every patient would definitely not appreciate me saying this to them, but when I get the vibes that they want to know more and I can say it to them about their diet changes and their health, I take every opportunity. I had a young girl here with her mom, and I did not know the family very well at all. She's about to go to college. She's a junior, so she'll go to college in a couple of years. She's 16, and she came in just with a lot of issues with her knee. And they had tried everything. They had surgeries, they had injections, they had tried everything, and just looked distraught and exhausted. So I took a deep breath, kind of stood back. By the grace of God, the surgeon I work with wasn't here, and they were on my schedule, so I had plenty of time to spend with them. And I just started talking about diet and changing, and all of us were crying in the room. And they were just so thankful to hear a different approach and to try anything where they didn't have to do something invasive and they could try to heal the daughter's body from the inside, that they clung on and they went with it and they are doing it, and we'll see how it turns out. But they were so receptive to the idea.
Yeah.
So
Yeah.
I talk to people about supplements and diet and
Yay. We
go
got it.
for it.
It just increases your toolbox, right? It's always about the yes and. We always do the good conventional things that need to be done. And you can always incorporate nutrition, better nutrition into whatever we're doing with health, whether it's your knee or your heart or your lungs or anything. So I love how you've been able to embrace it and use it in all aspects of your life. And that will just help Hayes as he gets older and when he goes to college and when he's not under your roof anymore, he's going to understand how this food impacts his body.
Right. And it's such a big responsibility for a 3-year-old to, I mean, he tells his babysitter, he tells the kids when we went to the play date for his preschool class, they served cheese sticks. And he tells his class and the parents, I can't eat cheese sticks. And he's sad about it, but we have our backup snacks, which don't include dairy. But for a 3-year-old to already grasp that and know dairy gives me a bellyache, I can't eat that. I have lactose free ice cream or dairy free ice cream. Like he's so in tune with his body already and he doesn't even know it.
Yes. Oh my gosh. Well, thank you. And that's part of what we do in the course is give you the swap outs and just help because it's usually it's a gradual process to figure out, what are they, if they're not going to eat that, what are they going to eat? And then what other, what supplements do we need to add in? So thank you. I appreciate you so much. And I'm glad he's doing great and continues to do well. And have anything else that you want to say or anything?
I'm so thankful for you and what you've taught me and for you filling up my toolbox with all of this knowledge that I didn't know or understand until, I got into this constipation course. So I am so thankful for you
Yeah.
and just appreciate you.
Yes. Oh, absolutely.
Can
And
you make one more compliment that I have to give you? One
oh,
more thing that stuck with me was, and it's so hard to make the changes. One thing that you said that resonated was, we're all going to make mistakes. He's going to have a glimpse of pizza or ice cream, which he does. He occasionally has a little bit, but as long as he is on this medication, he's fine, and that's his barrier, and it has not affected him at all.
and when you say medication, you mean the
But,
supplements.
yes, and I mean, you showed me that none of us are going to be perfect at this. We're all going to have our relapses where, especially a 3-year-old, where they need a bite of their brother's pizza at a school function or lunch, and it's okay. It's not going to permanently mess him up,
Yeah.
and it's okay to do that. So
And in
very thankful.
this is the realm where knowledge is such power because once you really understand that cumulative inflammation and that a couple of bites is very different than a 6-ounce glass of milk and
Yes.
how the system is going to react. And once it's right, just like that sprained ankle is once that inflammation is down, he probably would eventually be able to tolerate a glass of milk. You wouldn't want to do it all the time, but he probably won't go into that huge belly pain and everything when he gets to that point.
Yeah.
And so with the constipation course, because we did all of this as just online through some education and are these open office hours calls, would you recommend this for other parents?
Oh, 100%. I would do it. I would do it again. I would do it in a heartbeat just because I feel like there's always things to learn. And I mean, the support system that you get from the other people on the calls from you, it's just a wealth of knowledge. And yes, 100% recommend it.
Awesome. Well, super. Well, thank you, Lacey. We will let you get back to work, but we appreciate you and have a great day.
Thank you. Bye.
Bye-bye.